So today we're going to be covering the special tests of the upper extremity, and all of these can be found in the upper extremity reference section. So for the apprehension test, we're going to be referring to reference 9, and this test tests for shoulder instability, and the clinician is going to abduct the patient's shoulder to 90 degrees and then externally rotate. And during this motion, they're going to be looking for any signs within the patient's face of apprehension, fear, pain, and these will all be positive signs for this test. And the reason that we do this test and why this test works is there's a lot of ligaments within the anterior shoulder, and if these ligaments are stretched out, then they are unable to hold the humeral head in the glenoid fossa as they are supposed to, and so doing this position overstretches them even more, and so it makes the patient possibly fear of dislocation. And the sensitivity for this test is 90% and specificity is 85% when they are combined with relocation, load and shift, inferior sulcus sign, and a crank test. So these are all other tests that can be put with this to help with the apprehension test. For the AC joint compression test, we're going to be referring to reference 4, and this is going to test for an AC joint sprain. You're going to have one hand on the spine of the scapula, one hand on the clavicle, and then you're going to push together. And a positive sign for this is that it will be painful, or you can have abnormal movement within this area. And the reason why this test works is that you have the acromioclavicular and the corticoclavicular ligaments, and they attach to the acromion to the clavicle and the acromion to the coracoid process. And doing this test is going to put stress within these ligaments. And the sensitivity for this test is 41% and specificity is 95%. For the AC joint palpation test, this is going to be referring to reference 13, and you're going to just come up, find the AC joint, and put some pressure on that. The positive sign is pain, and the sensitivity is 96%, specificity is 10%. The reason why this isn't a good test by itself, but compared with the AC joint compression test, it's a good test because it's combined together, equaling out the sensitivity and specificity. For the external rotation lag test, we're going to be referring to reference 2, and this is going to test for a rotator cuff tear. The most common rotator cuff muscle to be torn is the supraspinatus. Now, to test for this, you're going to abduct the patient's shoulder and then externally rotate, and then the patient should be able to maintain this position. So I'm going to let her go. So she's able to maintain. So this means she does not have a rotator cuff tear. And then bring her down. A positive sign for this test is that they are unable to maintain this position. So the reason why this test works is because the supraspinatus abducts the shoulder to 0 to 30 degrees, and then it externally rotates slightly. So if it is torn, they will be unable to maintain this position. And the specificity for this test is 91%, and the sensitivity is 45%, with a QUADS of 13, making it a good test. The Hookup test, we're going to be referring to reference 10. And this is going to be testing for a supraspinatus tear as well as the external rotation lag test. And with this test, you're going to bring the patient's hand across to the contralateral shoulder and then push down, resisting this motion as they abduct. And so a positive sign with this is pain in the shoulder, or they're unable to maintain this position. And the reason this is a good test as it works is because the patient is horizontally adducted, putting pressure on the supraspinatus, and the hand is now fixed, and since they're abducting, this is going to be activating the supraspinatus muscle, and it's at its shortened range, so it's going to have to work harder, making it that it's going to not be able to maintain this position. And the sensitivity for this test is 94.1%, and specificity is 76.6%. For the internal rotation lag test, we're going to be referring to reference 7. And with this test, it's going to test for a subscapularis tear. The clinician is going to bring the patient's arm back into internal rotation and then lift off so the hand is not touching the back, and then they want to maintain this position. So you're going to lift, good, and then so a positive for this test would be if the patient is unable to maintain the position lifting off of the back. And the specificity and sensitivity for this test is, sensitivity is 97% and specificity is 96%. Now this looks like it's a good test, however it has a poor QUADIS score. The QUADIS score was 8, and according to Cook and Hegedus, they said that the researcher was biased and he didn't report all of the findings. Therefore, this test isn't the best one that you would choose. So with the supine Napoleon test, we're going to be testing for a subscapularis tear, and we're going to be referring this from reference 12, and going to have patient bring your arm up here, and then I'm going to hold down here because I don't want any movement at the shoulder. I'm going to ask her to bring her elbow upward. Okay, so she did that motion, and a positive test for a tear would be that she wouldn't be able to lift up. And the reason for this is because this motion is internal rotation, which is the primary motion of the subscapularis. And the sensitivity for this test is 84% and specificity is 96%. So for the bear hug test, we're going to be referring to reference 3, and this test for a subscapularis tear. We're going to have the patient bring their arm up onto the contralateral shoulder. I'm going to put one hand here, resisting any motion at the shoulder, the unwanted motion, and I'm going to try and pull her hand up while she's going to resist that motion. So I'm just going to pull up. Good. And you can go and relax. And a positive sign for this test would be that they're unable to maintain that position. And the reason for this is because this is just an internal motion, once again, just as the other subscapularis tests. And the sensitivity for this test is 60% and specificity is 92%. So for the biceps load test, we're going to be referring reference 8, and this is going to be testing for a SLAP lesion. And I'm just going to have the patient abduct their arm to about 90 to 120 degrees, and then I'm going to resist flexion. So she's going to maintain this position, and I'm going to resist this motion here. Good, and go ahead and relax. So a positive sign for this test is pain within deep in the shoulder, and this isn't the best test specifically. The sensitivity is 91% and the specificity is 97. However, the Quadis was only 9, and this test was only repeated on those with anterior dislocations, so they didn't get a wide variety of subjects. And the reason why this test does work is due to it makes the biceps in a shortened position, and resisting this motion would cause pain at that origin of the long head of the biceps tendon.